Good morning, everyone. Uh, Today, we are going to talk on community participation in palliative care. Earlier, we have already discussed what is palliative care, what is its importance, and how it should be implemented. We have also discussed what is the focus of, what is the goals of palliative care, how it is different than the main line of treatment, right? But there are many challenges in implementing the palliative care in society, which is very important. We have to involve the society. The community participation is utmost importance if you want to deliver your best in the society. So, understanding the role of community in the promoting health, that is we are going to talk today. How community can be involved, what are the challenges we face in involving the community, and how we can solve the challenges. So what is the community participation? First of all, we must know involvement of people in planning, implementing, and evaluating the health program. It is based on the principle health by the people and for the people. I think it is very clear. By the people means people, community should involve in palliative care of elderly, chronically ill people living in that society. So interaction of that family, interaction of the patient with the society is very important. But how it will be done? This is the $1,000,000 question. We are going to talk about it. And for the people, you understand, means the person for whom we are planning the palliative care. Importance of community participation. Promote the ownership of the program. You know, any program cannot be successful if there are not the society feels that they all are the stakeholders. The stakeholders' ownership by the people is important and improve the sustainability of health initiatives. You know, in the polio vaccination movement, it was a big movement and all the societies, NGOs participated in this and it became a great success. And that is a very good question, a very good example how community is involved. Even in the COVID time also, you can see the many societies involved. That's why we could succeed in controlling the COVID. This is improve the sustainability of health initiative. If the community is involved, the program can be sustainable. What do you mean by sustainable? Sustainability in terms of physical, in terms of financial, and in terms of social. All the three aspects is involved. It enhances the efficiency and effectiveness of the program. If the community is involved, the efficiency of the program will be very good. And effectiveness will be also better. And ultimately, it increases the accountability. Accountability of whom? Accountability of the healthcare providers, because they are the bridge between the society and the patient. What is going to happen? Accountability means a volunteer cannot take it lightly if the society is involved and for the patient, because he is the bridge. He has to be responsible to the society and to the patient both. So the key concept of the community participation, small action build a safety net. It means it needs assessment, planning, implementation, and evaluation. So this is the small action build a safety net. Safety net means what? Assessment to evaluation. And not everyone contribute equally, but inclusive matters. You know that if you are a team leader, you cannot expect that all the volunteers, all the participants, all the stakeholders should have same amount of devotion, same amount of time, same amount of responsibility. It is not possible. One man will have more, one man will have less, number one. Number two, one man can have one aspect of the total story and another volunteer can have another step. Suppose a man is very busy but he is financially rich, he will finance your program. And the other man who is very skilled in job but not having money, he will do more physical work. So a spiritual guru is there, suppose in your network, a nursing staff is there. So what they will do, everybody has a different job. and everybody has a different time. So we have to manage them how that we can have the best report, best outcome. So it needs assessment. See, palliative care is a subjective. It is patient to patient. It is cannot be a model for everybody. One model cannot fit for everybody. So one have to plan accordingly. So need assessment of the case, then plan it accordingly, then implement it. During planning, it's fine. When you come to implementation part, then it becomes challenging because it is a community which is going to help you in the planning. So everyone you have to keep in mind, and then you have to implement your planning. This is the key. Why community participation in palliative care is important? Why? One man can do it, one NGO can do it. When government is not able to do the whole country, how one society can do, how one man can do, it is all society should be involved. Support patients emotionally, spiritually, and socially beyond the clinical care. The palliative care, the focus of palliative care is not only the treatment, not at all the treatment. It is the symptom management. And for the symptom management, there are three things: emotional satisfaction, spiritual healing, and social networking for the patient. Because he is not moving, he is confined to his house because of immobility, because of his comorbidity. So socially, people need to go to meet him. He is not coming out, but people should go and meet him. A spiritual guru should go and talk to him spirituality if he likes. A musician should go and play the music if he likes. So what is the liking of the patient who is terminally ill? That has to be managed by the society. You cannot pay for everything. There are many people in the society who are very good in music, who are very good in spiritual talking, discussion, but they don't want money. But if you give them respect, they can go and they can deliver their content to the patient. This is the support, emotional support to the patient, spiritual support to the patient, social support to the patient. This is all can be done by community. Bridge the gap between the medical system and the home-based support. Every patient is not going to a old age home. He is living in his home. His family members are there, but they are not able to give, they are giving their best, but that best is not enough for the patient because they are busy, they are doing job, they are in some other profession. In that case, society fills the gap between them. That vacuum can be filled by the society. Suppose a neighborhood is there, a good neighbor is there, he is also a retired person, he can go and talk to that patient whose sons and daughter-in-law are in job, they are not getting time to physically interact. They are giving all financial assistance, they are giving food, they are giving shelter, but they are not giving time, personal time they are not able to give. In that situation, your neighbor, other friends in the society, they can come forward. And you have to motivate them to come forward. This is the job of the volunteer who is in the palliative care team, to see who are the people in the society who can come and talk to your patient. This is important. Enable culturally sensitive care through local understanding. Cultural sensitivity is very important. Somebody belongs to one religion, somebody belongs to other religion. They have a different belief in the life, in the God, in their way of thinking. That has to be taken in the mind. A religious aspect is very important if you are handling a elderly, ill patient under the focus of palliative care. So cultural sensitivity is very important. In which culture he is living. We say it is a Western culture, it is the Indian culture. What is the culture? Way of life is culture. For a man, suppose he is from the village background, he has a different experience of his life. He has come to the urban to live with his son and daughter-in-law in a metropolitan. There is a different culture. But you are focusing the patient first, then the family also. Then you have to be very sensitive for the cultural sensitivity of the patient. Next comes the enhances early identification of need and symptoms. This is also important. Early diagnosis. Prevention is better than cure. It is a slogan everybody knows. But prevention of what? if you know the problem. The problem is early diagnosis. Suppose I am a diabetic man and I am going to morbidity, nephropathy or neuropathy is coming to appear, then we should take care that it should not come. If it is coming, it should be delayed. Its symptoms should be controlled. So the early diagnosis of the complication is important, and accordingly, symptom management should be started. Prevention is better than cure. That is the slogan. This line indicates that part. Next come reduces hospital dependency and empowering family and caregiver. When society is involved, the person's hospital admission will be reduced. He will not go to hospital. If somebody is in the society, he will come and give him some medicine. He will take care because you know in hospital what you do, you give a treatment and also you give other parts in the hospital. And suppose you are in a private ward, the other things are taken care by nurses, by ward boy. So these things can be taken by your family members. If the family members are not free, by the society people. Lastly, build a trust, dignity and compassion in end of life. End of life means if the patient has a 1 month or 2 months to live, or maybe 6 months to live, he is completely immobilized, mentally and physically both. Physically he may be active, but mentally he is broken. So that broken feeling will go away if the people are from the society coming and meeting him. The trust, build a trust, maintain the dignity and the compassion. So this is very important part of the society. Now, understanding the home care. What is the definition? At the home for safety, comfort and dignity. Most of the time in Indian conditions, the elderly, sick people live in the home. We don't have culture of putting them to the old age home or to the hospice. They all live until they are alive in their home or in the hospital. So home care, because hospital is not a shelter home, it is for the treatment. If your treatment is going on and it is not going to be effective, the doctor says, take the patient to home and take care. In that case, the medicine will go on as a OPD case, not as a IPD case, not indoor patient, but outdoor patient. A patient has come to your home, he needs all these facilities which I talked in earlier slide. So one has to be very careful at home. Safety of the patient, because he is not able to move. Comfort, everybody has a different comfort zone. Family should identify it and try to give it. And then respect, because old age is, he should not feel neglected. This is the home delivery. Home is where the heart heals. Heart heals means what? Mind-body relation. If mind is very sensitive, this is a computer of your body. If your mind is happy, your body will be happy. So how mind will be happy? If he has dignity, comfort and safety. Three things are important, okay? Build a neighborhood network. When the family is there, then go to the neighbor, then go to the society. It is a chain process. Who is the first? Your sons and daughter-in-law, your grandchildren. If they are not able to cope up in totality, they should request their neighborhood. If neighborhood is not there, then they should go to the society. If society is not there, then they should go to the paid spiritual healers, paid social workers, paid psychologists. You pay money, they will come, because there are many good people, very skilled people in the society, but they need money. So depending on this, how much you want. So community-led care, local volunteers and professional support. This professional support is a paid, and local volunteers are also paid, but you can find it in they are less expensive because they're living nearby you. The components of the home care: physical care, I told you, daily work like bathing, feeding. Suppose the terminally ill people, they cannot move, they cannot go to the bathroom by themselves. You have to take care. The physical care, emotional care, companionship. Don't feel them that they are alone in the old age. Still, you should, somebody should there to give company. And lastly, safety check, fall prevention. Most of the old people cannot stand they lose their balance and they fall down. If they fell, they develop a fracture. If fracture is there, they're bedridden. All case is gone. Life is very pathetic if there is hip fracture in the old age. You have to take care that he should not fall. Fall is a very significant factor in geriatrics in old age. You have to take care of it. And types of participation. Voluntary work, physically a man is working with you. Representation in decision making bodies. Somebody should be there to decide about your health, about your future hospital management, about your treatment, and health education. This is also very good. Health education means, in Ayurveda it is said, Aharam Maha Aushadhi. Diet is the best medicine. But how to give diet which is compatible to that patient, depending on his age, depending on his digestive power, and depending on his taste, all the three things. So, ye has to, health education means there are many things, but I personally feel health education means hygiene, food habits, and psychological balance. Three things should be taken care. And monitoring the services. If you have hired people, then one should be there to monitor whether they are working properly or not. Check and balance is important. Now, the challenges in palliative care and how community participation, you see, what are the challenges? Lack of awareness about the palliative care. Limited trained professionals and urban centric service. This service is mostly present in urban, not in the rural area, and limited trained professionals. Very few people are trained in palliative care. That's why this course which you are taking, it is also, you are going to be trained as a trained palliative care giver so that you can do a job, you can work as a freelancer in the society for such patients. This course is meant for all of you. Cultural and spiritual disconnect. This is a very important part. If a professional is there, but culturally he is disconnected with the patient, so you have to choose a patient, volunteer who is not disconnected but connected to that culture, to the spiritual belief of the patients. Last, poor integration between hospital and the home care. You know, most of the time, as I told you earlier, in the palliative care team, doctor is on the top, but he is not available all the time. Volunteer is on the bottom, but he is available all the time. So he acts as a bridge. When it is required, he goes to the doctor, he asks, he get connected, telemedicine-like situation he creates, patient-doctor relation is developed, then he prescribes the medicine and volunteer implements it. So this is important, poor integration and financial burden on the family. How a volunteer will help in this part? Because he's already paid man. Suppose he's a paid volunteer and he is taking care. How he is going to reduce the burden? Very interesting. If your volunteer knows what are the government plans, what are the NGOs which are supporting this kind of patients, he can connect the family of the patient with those organizations who are supporting palliative care. So partial assistance, maybe crowdfunding, can help reducing the financial burden of the family in taking care of the patients. Now, addressing lack of awareness about the palliative care. Lack of awareness in the society. What is the method? Public awareness campaign, use radio, TV, community meetings to explain what palliative care is and how it benefits. Community workshop. We should organize workshop on palliative care, interactive sessions in schools, health centers and temples. Temple is a very good place where this kind of philanthropic societies, people having philanthropic ideas, they come in the temples. If you organize camp in temples, these people can be motivated very easily and they can come forward to help the needy people. Very important, community workshop. And then train local volunteers. We should have a workshop for training. I mean, this course which you are taking, 3-month course, but everybody cannot take it. But 1 week course many people can take it. We have to plan such programs, short programs, so that if common man can also learn ABCD of palliative care. This is important. Training. You start from a small module of training and then go for the bigger training, community leadership. And then distribute IEC material, provide leaflet, posters, real life story brochures in the local language. Local language is important. We are talking in English, the course is in English, but 60% people are the Hindi belt. They may be having problem. So we have to be very compatible to the audience. I mean, I hope that this lecture may have the Hindi script in the bottom so that everybody can understand it. Otherwise, we will translate it into the Hindi local. Leverage digital platform, share testimonial videos, explainers, content via WhatsApp feed. These are the advertisement method for social networking to bring awareness about the palliative care. If more people will know, more people will come forward. And then partner with NGOs. As I told you, they are the people who can help you financially and physically both to the patient. Action plan, weekly campaign, monthly workshop, quarterly evaluation of reach and impact. This is also very important, right? Now coming to the how to addressing the limited trained professional and urban centric service. This is a limited trained professionals are there. Earlier I told you, then how to manage it. Train community health workers like ASHA workers, ANM. They are already in the field, but they are not well acquainted with the palliative care services. If they are trained, it will be much easier for us to communicate with the society. Integrate into the medical education. Palliative care is taught in the MBBS or BAMS course, but not much focus has been given. If we integrate with the regular course, graduate course, with some workshop, with some training, it will be much better to have the trained people. Because doctors know everything, but they don't have time. They don't give importance to this. So if it is included in the course, like a skill development program, it can be very good for the society. Mobile palliative care units. Some mobile vans are there for healthcare. Mobile palliative care units can also be established with the help of the philanthropic organizations, with the help of the banks. They give the ambulance, right? But this ambulance is for taking the patient. But this palliative care unit will have a complete unit. It will have a social worker, it will have a psychologist, it will have a nurse, and it will be connected telemedicine through a doctor. Doctor is not going in the mobile van, but he is monitoring the mobile van. He is controlling the mobile van. He is the team leader. Doctor is the team leader, and this mobile van is working for him. So tele-education and e-monitoring and decentralized services. Services should be decentralized. A volunteer is there, he is not supposed to give attendance everywhere to the somewhere and coming 2 hours is wasted in that. Decentralize it. But responsibility should be fixed. That is how. And the public-private NGO collaboration, this is also important. Action plan and monitoring should be quarterly, monthly and annually of the whole action. And addressing cultural and spiritual disconnect. This is also important because cultural and spiritual disconnect is there. How to handle it? Involve spiritual and religious leaders, number one. Use culturally relevant communication. Local customs, dresses, festivals, involvement. These things are important. Train health workers on cultural sensitivity. Include modules about local tradition, death rituals, and family structure. And then offer home-based rituals. Allow space for rituals, music, prayer that the family and patient values during their care. Very important. Create spiritual concern. Designate quiet space for prayer or reflection in hospitals, hospice and care centers. Where the patient is, depending on hospital, you have to designate quiet space for prayer. And provide spiritual counseling. Connect patients and families with trained counselors or community spiritual gurus. Action plan, collaborate with the faith-based institution, monthly cultural competence workshop, and quarterly family satisfaction survey on collaborate with the faith-based institutions like the temples, churches. These leaders should be connected. Address poor integration between hospital and care. This is why how you will address. Establish hospital link home care units. Now the telemedicine is very common. This can help you. Set up telehealth lines, the same thing. Standardize the referral protocols. The referral protocol should be standardized. If this symptom comes, a referral should go. If a neurology issue comes, it should go to the other places. Depending on the symptom, different doctors should be connected. And discharge planning with the home support. Involve family members and community health workers during the discharge itself. And train community lesson offers. Appoint staff responsible for bridging the hospital. Even the trained nurses, they are important here. Enable access to health record. And health record should be properly maintained. Now the ABHA portal has been launched by the government of India, and ABHA has a space where all the reports can be uploaded. So anywhere they can be seen. And financial burden, as I told you, promote community-based palliative services, launch local donation and crowdfunding drives, provide basic medical kits. Medical kits can be provided as a donation by the society. Include palliative care in health insurance. Health insurance can also be, the premium of the insurance can also be managed by the society. Simplify access to government welfare schemes. All the schemes which are already in place, they should be connected to the patient and his family. So the financial burden will be automatically reduced because some finance will come from that. Like nowadays a 5 lakh health Ayushman Bharat program. It is covering a lot of things for the patient. He is not going to pay, but he is going to be treated. Similarly, palliative care, also some part can be covered in Ayushman Bharat. Trained family members in the basic care. If family member is trained, he will not hire people for every day. So try to train the family member as a caregiver for the small things the patient needed. Now, the learning object, coming to the last, define community participation, number 1. Understand its significance in public health, number 2. Explore types of and level of community participation and learn principles, barriers and examples. I would suggest all the participants to note down these 4 points and try to implement in your society where you are living. I am sure there must be an old man, there must be a chronically ill patient. Go and meet them, and whatever you have studied today, try to implement it. If you can, it can be very good for your learning. And principles and barriers of public participation, I have told you: equity, empowerment, sustainability, and cultural sensitivity. This is, I am summarizing it: the lack of awareness, poor communication, cultural belief, and lack of trust in the system, and socio-economic. So these are the things which you have to care when you are implementing this knowledge in your society. The lack of trained staff, I have told you, emotional and practical do's and don't do. Listen compassionately and assist with groceries and transport. Do. Don't do. Never replace a medical professional. You are a volunteer. You are not a medical professional. So always connect patient with that case. So engage the community strategies. Door-to-door campaign is important. Collaborate with schools and temples. And principles of community participation and level of participation. This is fine. Component community can help very well. Village health sanitation. This is a general information which you can learn, but in palliative care, these are not very important. For general health care, you have to do. Benefit of effective participation, improved health, I have already discussed all these things, reduced financial burden, empowered community. Method of financial, this is important, how you will collect the money. So, case study, example, organize charity events, and example, charity walk. So these are the donors, crowdfunding, these are the methods of crowdfunding. So, ultimately, community participation in central and public health to ensure ownership, relevance, and continuity, and health workers play a crucial role in changing the student activity and assignment. Scenario, practice a home visit, I have told you, patient feel isolated, task, volunteer pair up to act out support strategy. How would you support a caregiving family? And tips, link to benevolent group, offer practical help. Create a 1-month plan for your neighborhood. Template, goal, step, and resource needed. Interactive activity discussion. How can we increase community involvement in rural health program? Because urban is there, but rural health is lacking. So try to focus on this. Write a project on this. This is a reference. Thank you very much. Compassion is the key in palliative care. Thank you very much.